Hi, today we are going to learn about excipients used in tablets. Try to see what are the excipients and different excipients used in tablet formulation. The first one is diluents. We can call the diluents as bulking agents and fillers also. The other name for diluents are bulking agents and fillers. What they will do is they will make up the bulk of the tablet. If the dose of the tablet is less, they will increase the bulk of the tablet. And most of them are saccharides because we want them to be a simple entity. So, if it is a edible thing like saccharides, it will be good for us because they are used as a bulking agent. So, polysaccharides, if you see the polysaccharide, first one is starch. In the starch we have two types, hydrolyzed starch and partially hydrolyzed starch. Fully hydrolyzed starch or hydrolyzed starch are two types whose brand name is like MDEX and Cellutab. Remember this, fully hydrolyzed starch brand name is MDEX and Cellutab. Partially hydrolyzed starch are pre-gelatinized starch, that is STARX 1500. This is directly compressible, remember this. So, pre-gelatinized starch or partially hydrolyzed starch is directly compressible. Next polysaccharide which we are going to study is cellulose. In that the most common, very important is microcrystalline cellulose, MCC. The brand name in which that MCC is sold is Avicel. That is the brand name for this MCC, microcrystalline cellulose. Its uses are, it is directly compressible, it is a self lubricant and disintegrant also if you use in a proper concentration. Then diluents in disaccharides are lactose and sucrose. In lactose we have hydrous lactose and spray-dried lactose. This hydrous lactose is used because it is hydrous, it is used in wet granulation. It is used in wet granulation. If you want to prepare your tablet with wet granulation, use this as a diluent. It will undergo Maillard reaction. What do you mean by Maillard reaction is lactose will try to interact with the amino group present in the molecule, other molecule, and they will called color formation. There will be a brown color formation if you add these two in same tablet. So, try to avoid this if you do not want that. Next is spray dried lactose. It is also directly compressible and it has a, because it is spray dried, it has a good flow property. Next one is sucrose. The brand name for the sucrose is SugarTab, NewTab, Deepak. These are the mixtures of sucrose and invert sugar. Remember this. These are the mixtures of sucrose and invert sugar, and they are also directly compressible. The next one is sweeteners. We try to see what are the sweeteners, different types of sweeteners used in tablet. Obviously, we use artificial sweeteners such as sodium saccharin. What is sodium saccharin? Sodium saccharin is 250 to 500 times more sweeter than sucrose. But the problem with the sodium saccharin is it is carcinogenic and it will give a metallic aftertaste. So, it will give the metallic aftertaste. So, we need to avoid this because it is a carcinogenic. The next one is aspartate. Aspartate is 200 times more sweeter than dextrose and it does not have the aftertaste. Sucralose, it is 600 times more sweeter than dextrose, it is of 0 calories. So, if you want to prepare any medication or any food with 0 calories, try to use sucralose here. Next excipients used are binders and adhesives or granulating agents. What this will do is they will try to form adhesion between the particles in a given powder, or you can use it as a granulating agent. What is granulating agent? It try to form a granules. What is granules? Aggregation of a particles. So, these are some of the examples and its concentration of binders used in tablet formulation. One is cornstarch, we use 5 to 10% aqueous paste, then is starch 1500, again it is 5 to 10% aqueous paste, gelatin 2 to 10% aqueous solution, acacia again aqueous solution 5 to 20%, polyvinyl pyrrolidone 5 to 20%, it may be aqueous or alcoholic or hydroalcoholic both. Methyl cellulose 2 to 10% aqueous solution, and sodium carboxymethyl cellulose 2 to 10% aqueous solution. Then the next excipient used in the tablet formulation are disintegrants. What disintegrants will do is, the mechanism of disintegrant is, there are two types of mechanism for the disintegrants. What are this? First mechanism is they will swell, hugely they will swell, and they will take highly water uptake, and they will try to break the tablet. When you put the tablet, after adding disintegrants, you are preparing a tablet. If you put the tablet in the water, they will take more water in them and it try to break the tablet. That is the one mechanism. Second mechanism is generation of gas, as in effervescent tablets. In effervescent tablets, you can see the generation of the gas which leads to the disintegrate of the tablet. And these are the some examples and their concentration which are used as a disintegrant. Starch 5 to 20% weight by weight. Then starch 1500 is 5 to 15%. Avicel, I told you, this can be used as disintegrant if you use in a proper concentration. If you use in more concentration, it will act as a diluent. If you use in less concentration, it as a disintegrant. Next, alginic acid. Next is guar gum, and the last one is methyl cellulose, sodium carboxy methyl cellulose 5 to 10%. The main thing which we need to notice here is, see this one. What we want to see here is super disintegrants. This one. These are super disintegrants. They will disintegrate as tablet within seconds. The example for that is cross carmolose, locust gum 10%, cross providone, and sodium starch glycolate. The brand name are Primogel and Explotab. The last one is lubricants, glidants or antiadherents. So, what are lubricants? They will try to reduce the friction between your punches and dies. So, these are the lubricants. Example are mineral oil, talc, metallic soap and high molecular weight pH. What they will do is they try to reduce the friction between punches and dies and helps in tablet ejection also. Then anti-adherent, they will avoid sticking and picking. This anti-adherent will avoid the adhesion of, after punching the tablet may stick to the die, that is called sticking. It may stick to the punch, we call it as picking. So, sticking and picking can be avoided by anti-adherent. They are not going to adhere to anything. That what is anti-adherent. Example is mineral oil, talc and metallic soap. Next is glidants. This promotes flow. They will reduce the friction between the particles. Example for glidants are talc 5%, cornstarch 5 to 10%, colloidal silica 0.25 to 3%. The other name for, marketed name for colloidal silica are carbosyl, siloid and aerosyl. Remember this. These are the example for the glidants. So, I hope you understand. Thank you.